Yes, good evening. Thank you so much for watching. We have been talking about different things, but today we are talking about tongue tie. Tongue tie can be given different names in different local languages, but it is called Ankyloglossia in English as some other name, but of course it has other names in different local languages. But it literally means the situation where the tongue is at birth, the tongue is unable to move freely. The tongue is restricted in its movement. Remember, the tongue is supposed to perform different activities where it is supposed to move in the side, that is lateral, left, right. It is supposed to move in the front, what we call protrusion. It's supposed to help in moving up and down. If a baby is breastfeeding, if a baby is, if a person is doing other activities in singing, in talking, in eating, suppose even to roll food as it pushes it in what? In the oral cavity. So this abnormality or this situation where someone is born with what we call a tongue tie, it affects our children, it affects us, or it affects people in adulthood. How do you suspect that somebody has a tongue tie? Now, one, if somebody has a tongue tie, he is unable to push the tongue out. The tongue is supposed to move out. But somebody with a tongue tie, the tongue does not move past the lips. If he has teeth, does not move, or she or he has teeth, the baby does not move, the tongue does not move past the lips or past the teeth. If somebody has teeth, if at all this person tries as much as possible, it will form a heart shape, the shape of a heart. When I talk about the heart, you can easily know what I'm talking about. The heart, the shape of the heart, because it is in form of a notch. In form of what? A notch. That is one. When you see a baby like that, having a tongue which is restricted in moving out, and if it tries to move out, it forms that notch. As a mother, as a parent, as a teacher, as a neighbor, as a social worker, as a good citizen, you should suspect tongue tie, or what we call Ankyloglossia. We can also suspect that a baby has tongue tie when there is difficulty in breastfeeding. You know, another function of a tongue is that it must move up and down, make that suction as like you make when you are taking soda or juice using a straw. So also the baby has that suction movement that it does, or the baby does, using the tongue in breastfeeding. So when someone has tongue tie, that ability is not there, and the baby is going to have difficulty in breastfeeding. If he tries breastfeeding, the breast milk is going to pour out of the what? The oral cavity. When you see such, you suspect what? Tongue tie. The tongue is also equally supposed to move up and down, then so that you can clean the oral cavity. We talked about in the previous video that after giving a baby syrup, after giving a baby different food, you must get a gauze and clean, especially babies who are unable to clean the mouth. So because of this restricting movement, a baby is unable to, you are unable to clean there, and the baby always has poor oral hygiene. So this is another sign of trying to think or to suspect that you need to visit the dentist, because someone has what? A baby has what? Tongue tie. Another one which is very common, which many people know, is the speech. A baby who cannot speak well. The first thing would be Is the tongue moving up and down? Is the tongue able to move and twist to take part in speech? If a baby is unable to speak, you can also suspect what? Or speak words very well, suspect what? Tongue tie or Ankyloglossia. Now, some people may think, why don't we handle it? Because like many communities do, they have their people who can handle some of the issues at a local level. Like we talked about oral infant mutilation. Oral infant mutilation, or what we call false teeth extraction. We talked about those complications that we can get if you take your baby for false teeth extraction. We can also have very bad consequences, or very many consequences we can have once a parent, once a neighbor, once someone takes a child to local people or to people who are not trained to have this tongue tie treated by those local people. Because sometimes one of the problems we get, people can bleed to death, can get infections, people can even have the salivary glands cut. So you need to visit a dentist, you need to visit an oral surgeon, you need to visit the hospital so that you can be helped, so that they can confirm whether your suspicion is right or wrong. If at all they find your suspicion is right, then you are okay. If you find it is wrong, you are still, it is what? It is also okay. So whether it is right or wrong, at least it's always good to visit a what? A hospital. And what is going to be done? It can be released. That one we call it frenectomy, the tongue release. Sometimes if it is an adulthood, we can have other procedures where it can even be cut very well and sutured or and corrected, even if someone is already what? An adult. But it's always good for you to reach the hospital and you do what? Those procedures very well. Other procedures, or we can always explain them in the medical lecture, but for us in the community here, we are talking about frenectomy, tongue release, but we can have other surgical approaches, but all of them are aiming at releasing the what? The tongue, so that a tongue can move freely up and down. Now, what if I don't take the child there? Is there any problem? Some people will say, no, they will fear. They will not reach the hospital. Somebody will not be able to perform the other functions of the tongue very well. Things like singing. Someone can be born with a talent, but because of failing to push the tongue out, he's unable to perform it well. Somebody is not, a baby can have even nutritional problems because he's not breastfeeding well. If the baby tries to breastfeed, the breast moves out or pours out. So a baby can have those problems. Suppose also a baby can also have problems like social activity. The tongue can be used for maybe in kissing at adulthood. If a baby does not have, if a child is born with this condition, has not treated, this one is not what? Obtained. So it is always good for you to visit a dentist, visit a oral surgeon, visit a hospital, and you are helped. Thank you so much for watching. Don't forget to subscribe to our channel. In case of any questions, put in the inbox. We shall respond accordingly. Thank you so much.